afternoon. My name is Saya Wen, and today's presentation is on the relationship between workplace burnout, anxiety, and depression. So to begin with, my topic of current interest is, of course, investigating workplace burnout, the rates and symptoms of depression and anxiety among mental health professionals. The purpose. Burnout is defined as a psychological syndrome that can be characterized by physical, emotional, and mental exhaustion. Has become one of the most widely discussed mental health issues within the workplace. 61% of mental health professionals meet the qualifications for clinical depression. Burnout rates within mental health professionals have also been correlated with decreased productivity, higher turnover rates, increased likelihood of developing depression. Excuse me. So my hypothesis is mental health professionals who experience an elevated burnout rate, as defined by Maslow Burnout Inventory (MBI), will also have higher symptoms of depression and anxiety, as defined by the Depression Anxiety Stress Scale. And then, in addition, I would like to find effective treatment modalities. Background research. Many mental health professionals experience distress as a result of experiencing secondary trauma while on the job, treating clients or their patients. This makes them increasingly more vulnerable to depression due to the exposure of these psychological stressors. More than 10% of employees have experienced burnout in their lifetime, or will experience it. Prior to the COVID pandemic, 20 to 80% reported experiencing symptoms of burnout. And of course, since the COVID pandemic, these numbers have gotten increasingly higher due to the larger need of mental health support coming from the global pandemic. As a result, employees are being forced to work longer hours with increased caseloads, additional demands on the job, and fewer supervision hours provided. This has also impacted the balance between work and personal life, which is a contributing factor for burnout. My biblical foundation comes from Luke 22, 40 through 45. And I want to focus on the point where we start with he withdrew about a stone beyond them, knelt down and prayed, and threw it beyond him. Sorry. And he said, Father, if you are willing, take this cup from me, yet not my will be done, but yours. Then an angel from heaven appeared to him and strengthened him. And being in anguish, he prayed more earnestly, and his sweat was like drops of blood falling to the ground. When he rose from prayer and went back to his disciples, he found them asleep, exhausted in sorrow, and asked, Why are you sleeping? Get up and pray so that you will not fall into temptation. And that comes from King James Bible. And I know this quote, this Bible verse originally was intended for the night before Judas actually betrayed God, and he was asking for God basically to have his way. And I feel like as providers, we all often need God to just step in and help us and to make us stronger. So this verse really spoke to me. Next is my references. And then the other side is also references. And this concludes my presentation. Thank you.